Nebivolol is a medication primarily used to treat high blood pressure hypertension. It belongs to a class of medications called beta blockers. Nebivolol works by relaxing blood vessels and slowing the heart rate, which improves blood flow. This action helps in preventing complications such as strokes, heart attacks, and kidney problems. Nebivolol is a receptor blocker with nitric oxide potentiating vasodilatory effects used in the treatment of hypertension. It is highly cardioselective under certain circumstances. Pharmacology, mechanism of action. Nebivolol is a selective receptor antagonist, which means it specifically blocks the adrenergic receptors without affecting the receptors at therapeutic doses. This selectivity is dose-dependent. Nebivolol loses its selectivity at higher doses. Unlike other blockers, which are used to treat hypertension, Nebivolol also causes vasodilation by increasing nitric oxide levels. This is due to its interaction with L-arginine, leading to an increase in nitric oxide formation. The vasodilatory action reduces systemic vascular resistance and leads to a reduction in blood pressure. Pharmacokinetics. Nebivolol is metabolized by the liver, primarily by direct glucuronidation and by cytochrome P450 mediated oxidation. The drug has an elimination half-life of about 10 hours, and its metabolites have an elimination half-life of 24 hours. Nebivolol and its metabolites are excreted in urine and feces. Medical uses. Nebivolol is used primarily for the treatment of hypertension, high blood pressure. It may also be used in conjunction with other medications for heart failure treatment. Side effects. Common side effects of Nebivolol include headache, fatigue, and dizziness. Less common side effects can include slowed heart rate, reduced blood pressure, which can lead to dizziness or fainting, swelling of the hands and feet, and difficulty breathing. Contraindications. Nebivolol is contraindicated in individuals with severe bradycardia, heart block greater than the first degree, cardiogenic shock, decompensated cardiac failure, sick sinus syndrome unless a permanent pacemaker is in place, and severe hepatic impairment. Interactions. Nebivolol can interact with other medications, including other beta blockers, antiarrhythmics, and certain antidepressants. It's essential to inform the healthcare provider about all medications and supplements being taken to avoid potential interactions. Formulations. Nebivolol is available in tablet form and is typically taken once daily. It's important to note that, while Nebivolol is effective in treating hypertension, it should be used under the guidance of a healthcare professional. Regular monitoring and follow-up are essential to ensure the drug's efficacy and safety.